Hello, today we're going to be talking about supply of labour and nursing in the UK. So this was the 2022 question, I believe, in the paper one, and it was badly attempted. I think on the guidance, the examiner report, we saw that actually people did relatively badly in this question. It seems relatively easy because it's simply evaluate the factors that might influence the supply of labour in an occupation of your choice. However, because it doesn't seem that there's enough to talk about, it's not immediately obvious what your 2 points could be. Certainly, to begin with, we want to define the supply of labour, the number of workers who are willing and able to work at a given wage rate. I think labour market failure might be a useful thing to define. We may refer back to that later on. We've got a misallocation of resources, a misallocation of our workers due to occupational or geographic immobility, and we could talk about that later on. And we're going to say first and foremost that the essay is based on qualified nurses. Now, the examiner reports are sometimes conflicting. In this one, it does say that you can talk about multiple sectors, multiple industries. So you could have talked about two, but in general, my advice would be just talk about one. It keeps the essay nice and clear and you don't wander around. Before we start, please take a look at some of these this bit of data that I've got on the screen here. You can see that nurses have annual leave entitlement, there's the salary scale, there are plenty of benefits to being a nurse, non-wage benefits you can see there. And finally, NHS staff pay from 2010 in real terms adjusted for the cost of living, and you can see that the nurses, that red line here, it's less than it was in 2010, but clearly you can see that the wage rates have gone up from 2017, possibly after Brexit, possibly we're struggling to entice or to incentivize nurses from abroad to come to the country, and therefore we need to raise that wage rate. Okay, try and plan the essay now. Think of what your 2 points could be, and then come back and we will plan each point. Okay, so I've divided this up. I need some theory to help me. I've divided it up into two parts. I've divided it up into non-wage factors, and we can really go down a list of things that could mean that we have a shift left in the supply of labour. And we're looking at wage factors here and the monopsony power of the employer. So first of all, non-wage factors. Well, we want to look at this diagram here, and first of all, as always, talk about the first equilibrium, the initial equilibrium where we're at WR1, that wage rate, and Q1 nurses employed. Notice that I've got nurses on the axes there as well, really important. And also I'm using MRP and SL here and here. Okay, so really important to use the right figures there. Now we can define the supply of labour as the willingness and ability of workers to work in a given industry. So we can actually talk about both of these things. For some reason, my highlights seem to be jumping around a bit today. But the willingness, that is whether you're incentivized to work in that industry. Do you want to work there? And you could mention all sorts of things. Working conditions. Now, we could apply that to nursing. We know that working conditions are tough. It's stressful. You're watching people who may well have very serious health conditions. That may be stressful, and you may feel as though you're poorly managed for things like that. You could talk about working hours. Things like that could be very, very difficult and may be difficult to manage. And so you may argue that the non-wage factors of willingness may be lower because of that. Your ability. Do you have the ability to work in this industry? Well, that could be due to the low ability could be due to the high training requirements, the long amount of time that it takes to train to be a nurse. You do require A-levels and a nursing degree. So it may be that shifts the supply curve to the left and results in a lower quantity of workers to be supplied at Q2, and therefore that might result in the shortages that we've talked about in the question, that the question talked about. Now, there's a lot of, it's not hugely theoretical, but actually it's about remembering what those factors are which affected the willingness and ability of workers to work. And so that really is about going back through your notes and looking at that. Right, now think about how could you evaluate that? How could you argue against and say, actually, there is a high willingness, there's a high ability, and actually the factors that we have seen here are not that important? Well, you could look at some of these ideas that you had on the right-hand side here and think about those, and come back in a second once you've planned. Okay, coming back, what did I see? Well, I said that, well, skill shortages may not exist. Labour market failure in this market may not exist. We have funding programs for nursing degrees. We know that the UK government funds that and gives bursaries for students, in which case the occupational mobility of workers is likely to be higher than we would otherwise thought, and the ability of nurses would be higher, and therefore the supply would be higher as well. Whenever you're evaluating, do go back to the question, do go back to what you were talking about here, and in this case we're talking about the supply of labour on that diagram, whether it shifted to the left or the right. You could also argue that the skill requirements may be lower than other professionals. We do have different bands of pay scales. We have different skill rates of nurses. So you might argue that actually in many of the base sort of nursing bands, the lower bands, the more basic nursing areas, the qualifications aren't particularly high and the skill requirements may not be that high. There are many other factors. We could argue the other way, though, that there are many other factors making it an attractive profession. You are saving lives. You're helping others. There may not be the same level of discrimination that you may see in other industries, and we know that because nurses come from all over the world in the UK. Now, saying that, that just reminds me of a point which I haven't put in here, but I will just put here as well, and that is being from abroad. Willingness and ability. Now, that's quite interesting. The wage rate in other countries, we can talk about that, may cause brain drain. So it might be that other countries have higher paying nursing providers, for healthcare providers, which would pay more, and therefore the nurses in the UK would then move to abroad. It may be that nurses from abroad cannot move to the UK because of Brexit. You might talk about Brexit and say that actually Brexit and visa requirements for nurses means that now we have fewer workers from abroad being incentivized to come to the UK. And that refers to the ability of foreign nurses to come to the UK and work. And that seems to be a very big problem recently, particularly after 2016. Great, let's talk about wage rates. So I'm trying to divide this essay, and I think the structure is hard. We're trying to divide the essay into two and have two very separate things, because otherwise this essay can just end up in a big long list of factors and doesn't have very much analysis, which is, I think, why many people struggle to get high marks. Right, take a look at that diagram and see what you can think about how the wage rates affect the supply of labour. By the way, this ACL here is also the supply of labour. That might help you. Right, coming back. Well, this is all about the NHS being a monopsony employer. A slightly complicated point, but actually one which makes a lot of sense. A monopsony employer is a single employer in the labour market, and in the perfectly competitive labour market, we know that supply is equal to demand, and Q1 workers would be employed at wage rate WR1, as we see in the diagram above. However, single employers have monopsony power that enables them to lower wage rates and maximize profit. And you maximize profit where MCL, marginal cost, is equal to marginal revenue. In this particular diagram, that would be where marginal cost of labour is equal to the marginal revenue product of the worker. That means that where you are at that position, every worker who yields a positive marginal profit has been employed. No workers who yield a negative marginal profit or a loss have not been employed, and therefore you have maximised your profit. So only workers who make a marginal profit for the firm are employed, who increase the overall profit of the firm, and therefore the wage rate is reduced to WR2 and the supply of labour falls to Q2. Again, therefore, coming back to the question, being a reason why the supply of labour may be low in the nursing industry. However, I'm not sure if that is true. So let's try to evaluate that. Actually, think about it yourself. How could you use the wage elasticity of supply of labour to discuss to what degree does falling wages result in changes in supply? And you might think about the amount of monopsony power that the NHS actually has. Think about those ideas and then come back in a second. Right, so this does depend on the mobility of labour, and it depends on whether workers are able to move to other sectors or other countries with higher wage rates. So as their wage rate falls, do they have the skills? Do they have the ability to move to other areas, which would then reduce the supply of labour? And then we could link to W, the wage elasticity of supply. If they are very, very mobile, then that means that the WES would be elastic. And that would mean that there would be a proportionally larger fall in the supply of labour than there would be in the fall in the wage rate, in which case the supply of labour would be much lower because of the monopsony power. That's quite interesting. I'm not sure to the degree to which this happens, but I think if you say that a lot of nurses in the UK are actually from abroad and their wage rates in real terms go down, it might be that you have nurses going back to their home countries, in which case they may actually be relatively geographically mobile as a result. You may say that nurses also possess lots of skills which are useful to other sectors, and they may well be able to work in care industries or anything which is customer facing, which again would make them occupationally mobile. And we could link that to the degree of labour market failure going on there. Ironically, labour market failure being high would mean that actually you'd have a higher supply of labour when the wage rate falls, if that makes sense. It does all depend on the monopsony power in the labour market as well. If there are other healthcare providers, then actually there may be options for nurses to switch to, say, Bupa Healthcare, who pay higher wage rates. And if the greater amount of the market that they occupy, say if they occupy 20, 30, 40%, then they will have a greater impact on the market, and the NHS will be more aware that as they lower their wage rate, their nurses will move across to the other employer. Now, I might also challenge the fact that is the NHS actually a profit maximizer? No, it's not. And it may not necessarily act in the same way as the monopsony diagram suggests. Right, that's judgment. Now you're trying to weigh up your ideas. You're trying to give an overall judgment, an overall conclusion based on what we've just said. And which one of those factors are most important, and what are the counteracting factors involved? I'll leave you some time to think about that. Okay, coming back. Well, in my view, the wage rate factors are outweighing the non-wage rate factors, particularly in the context of the cost of living crisis. And you can see that the wage rate here is, again, lower than, in real terms, than it was in 2010, and we might want to put that into context. A nice technique in a judgment is to use context, and so the context of the cost of living crisis may be useful there to show that actually nurses cannot afford basic necessities. We see news of nurses having to go to food banks, for example, and that may be a very strong factor which pulls nurses out of the nursing industry. And that has certainly been the case. The falling real wage rates accompanied by lack of supply. I may also say, though, that the visa restrictions that have been, which have been there, they may well mean that actually a larger amount of supply from abroad has been cut off as well. So we cannot ignore that factor. However, it is very much dependent on government policy, being a government-run industry, and therefore ability doesn't seem to be a constraint in the long term, as long as they are funding these bursaries for nurses, as long as they're funding and they're offering, and as the pay scale seems to suggest, they're offering a lot of career progression as well. It seems as though the government is able to change this and possibly offer higher wage rates and offer higher training schemes. However, I think the conclusion that I would give is that without higher cost of living pay awards, shortages are likely to continue unless visa restrictions are lifted. And so unless you do both of those things, it's unlikely that we are going to see a change in this industry, unfortunately. Okay, thank you for listening. I hope that was useful.